Welcome everybody to our presentation on the EUSARF Congress 2021. My name is Kristin Teuber, and together with my colleague Yvonne Kaiser, I will present some findings from our panel study, which focuses on young people's transition from alternative care to adulthood. With this, we hope to contribute to the debate on leaving care. We have conducted our panel study in 29 SOS facilities in Germany since 2014. The study covers a long time span that means growing up in care from the age of 12, preparing for transition into living independently, gaining ground as a young adult, and thriving up to the age of 30. This long-term perspective ranges from adolescence in alternative care to young adulthood out of care. We examine different aspects of life on individual and social levels, as well as aspects of the care system. Right now we will focus on the process of leaving care, especially on how young persons felt prepared for it, how they judged their time in care in retrospect, and on their social embeddedness. According to what was said before, we now pick up the following research questions. How do care leavers cope with the transition to adulthood in different aspects of life? How do they look back on their time in care and on their moving out? How do care leavers deal with personal relationships and their social networks? And how caregivers best support young people on their path to independence, especially in SOS facilities? Before we present our findings, let us have a brief look on our database in the care leaver panel. We have taken a mixed methods approach. We have attained quantitative data from questionnaire surveys that have been conducted every 2 years since 2014. 334 care leavers are in the survey right now and have been surveyed at least once. The qualitative data derives from current in-depth interviews from 43 young adults. Let us now summarize our findings from interviews. We asked the young adults how they look back on their time in care and the influence it had on their personal development. They talked about being stabilized in their life course and having gained competences for living on their own. They also felt protected from social isolation and bad influences from other persons, for example, difficult dynamics with parents. They became experienced in living in a community, gained self-confidence, and received assistance in coping with their past history. They felt enabled to attend school regularly and attained qualifications to help them manage the transition into vocational training or study. The interviewers reported an overall positive influence while growing up in SOS care. Becoming an adult means learning to understand experiences from one's previous life and being able to consolidate them into a consistent and coherent image. Among care leavers, this means looking back on their time in the youth welfare facility. This provides evidence of how well the time in care can be integrated into one's biography. Our questionnaire had 17 items concerning the residential care in retrospect. The participants were requested to indicate to what extent they agreed with the individual statements. Factor analysis of the care leavers' answers identified 5 basic attitudes. SOS as a rescue. This basic attitude means that life without SOS would have been worse and that it was good to have been in the facility. The alternative care exerted a sustained influence on the care leavers. SOS as chance. Care leavers who have the basic attitude are of the opinion that their time in the SOS facility gave their lives a positive twist of fate and opened up possibilities for them that they otherwise would not have had. Their experience in the care facility is part of these young adults' biographies. SOS as normality. With this attitude, care leavers treat their growing up in SOS facility quite openly and tell not only close friends that they lived in alternative care. SOS as a burden. Young adults with this attitude have experienced because of or in residential stay that still burden them. They report that people treat them differently when they find out that they grew up in youth welfare system. SOS as a blemish. This basic attitude is typical of young adults for whom it is unpleasant to have lived in a SOS facility. They do not want anyone to find it out. At the same time, they are still sad and angry that they could not grow up in their families of origin. We also found out that the less the care leavers rate their time in a youth care facility as a burden today, the more satisfied they are with their present life situations. In contrast, one can assume that past experiences that have not been sufficiently dealt with affect the present negatively. In the time of the SOS facility is perceived as normal, this is accompanied by a higher degree of life satisfaction. With the help of scales, we were able to identify how strongly pronounced the basic attitude is for all participants. 1 means hardly, up to 4 means extremely. The bar chart shows the average value for each basic attitude among all participants. SOS as a rescue, as a chance, as normality achieve the highest means. Agreement with these individual statements is higher on average than for SOS as a burden or as a blemish. In the questionnaire, we also asked the care leavers directly how they estimated their moving out of care in retrospect. Multiple answers were possible. 39% found the initial period of independence difficult to deal with. 45% experienced moving out of care as a deep divide in their current life. Nearly 50% had many misgivings before moving out on how things would proceed. And 63% knew what would occur after moving out. These values illustrate that moving out of care, often at the early age of 18, constitutes a huge challenge in young people's lives. They need not only good guidance, but also self-determination.
An emphasis of the qualitative interview is the topic transition and the experience of moving out. 4 perceptual patterns emerge from the care leavers' answers. The young people in the first group experienced the transition as a suitable step towards independence and a positive memory. They felt ready to move out and involved in all decisions concerning the transition. Tabea reported, "Somehow I had the feeling that I had slightly outgrown the facility." They often completed the transition step by step into a progressively more independent lifestyle. A further group experienced the transition more ambivalently and as a necessity. Benedict summarized, "It was also what I finally wanted, but it was clear that I couldn't longer remain there." On the one hand, these young people felt ready for the transition into autonomy, but on the other hand, they would have liked to stay longer if that had been possible. They participated in the decision to move out. The young people in the third group have a great need for self-determination and want to finally be independent of a care setting. Monique remembers, "I was 18 and wanted to get away, and then I packed my belongings and moved out." They only became aware of the consequences of their sometimes over-hasty departure during the further process. However, in their first crisis, they are ready to accept help and guidance again. The last group experienced a very abrupt and externally determined end of care when they came of age. Tanya, for example, quoted the Youth Welfare Service, "You are 18 now. We can't do anything more for you. There's the door." The young people experienced the move out as being kicked out and as a loss. They didn't feel involved in the decision to move out and needed further help and guidance in making a smooth transition into autonomy. The analysis of the interviews pointed out that the care leavers feel well prepared for their everyday practical tasks, like housekeeping, dealing with finances, etc. We noticed that in the preparatory and becoming independent phases during alternative care, we must pay more attention to psychosocial factors and focus on the following questions. Are the young people mentally prepared to move out? Are they emotionally stable? Do they have a functioning social network? Do they currently have relationships with important persons? Are their relationships to their family of origin clarified? How has the separation process from their care provider progressed? Do they have a partner, and if yes, does the partner support or impede their progression into autonomy? Our analysis have revealed important prerequisites for a successful transition. First, to involve the young people in all decisions concerning their transition, and second, that on their way to independence they need to receive professional counseling and, when appropriate, follow-up which are tailored to their individual needs. This requires a wide range of assistance. A central topic of our longitudinal study is the care-leaver social relationships. Both the questionnaire and the interview guidelines contain a number of questions on this topic. Together with the participants, we generated a network map to determine the current nature of the care-leaver social networks during the interviews. Social relationships are an important source of support during transition into autonomy. Especially young care-leavers often find it difficult to enter into relationships due to their previous experiences. The creation and maintenance of stable networks therefore often constitutes a great challenge for young people. Particularly those young people who have experienced a close affiliation with the children's village find leaving the community difficult. A sustainable social network facilitates the transition. In the interviews, care-leavers primarily describe small networks with selected persons who are considered as resources. These usually consist of fewer than 15 people, including their own families and persons within the care system. A friend is described as important or very important in their lives by a large portion of the care-leavers. It is stressful if no friends are available, especially if the ability to build up sustainable relationships is lacking. A good, trusting relationship to at least one dedicated professional carer is described as essential for a successful transition and the period thereafter. Above all, the children's village mother remains an essential role model even after moving out. The total results of our evaluation of the broad field of relationship building have produced recommendations on 3 closely correlated fields. Within the context of leaving care, professionals are confronted with the following tasks. First, strengthen the young people's network competence early. Care-leavers need support in the process of becoming emotionally independent and in creating a sustainable external peer network while they're still in care. Second, professionals must consciously shape the process of letting go. The process of becoming independent and the imminent discharge from alternative care into an autonomous life requires a conscious framing of the change in the care relationship. This primarily involves perceiving and accepting the ambivalence between attachment and letting go. The professional's third task is to help the young people position themselves within their family of origin. They require discriminating guidance while sounding out and defining their relationships to their parents and the corresponding support in approaching or distancing themselves from these families. In conclusion, we would like to briefly summarize our results. First, when looking back at their experiences in youth welfare facilities, the young people reveal different basic attitudes. In relation to their care experiences and integration in their current lives, the data show the less stressful the time during their alternative care is perceived, the more satisfied the care-leavers are with the current living situation. One can accept as a hypothesis that not sufficiently overcome negative past experiences affect the present negatively. The transition phase into autonomy is experienced quite differently by the young people. Accordingly, the supportive measures must be tailored individually and according to need. A successful transition requires both participation on the part of the care-leavers and guidance by the professionals. Third, a key to successful transition into autonomy is social support. Social competence must be promoted and guided during the residential stay to help the young people create sustainable relationships and to consciously shape them. Thank you for your attention. For further information, don't hesitate to contact us or visit our homepage. Thank you.